Earlier this month, researchers at BC Children's Hospital discovered a new disease called gain-of-function Mark IV. It's a breakthrough they say will impact families worldwide by shortening the period of diagnosis for those with similar symptoms. Researchers are constantly trying to diagnose unique or unknown symptoms in order for patients to receive treatment, but the process is often difficult. For more on how family doctors are involved in this process, CBC health columnist Dr. Melissa Lem joins us now. Nice to see you again, Doctor. The term SWAN stands for syndromes without a name, often used to refer to someone experiencing diagnoses or symptoms of genetic conditions that have not been diagnosed. What makes these symptoms especially hard to diagnose?
Well, these are the unsolved mysteries of the medical world for a number of different reasons. First of all, they're very rare. Many of us have never learned how to diagnose these syndromes in medical school or residency. And even though there are over 7,000 different rare medical genetic diseases, a lot of us have never encountered them or knowingly encountered them in our practices. Other things that make them hard to diagnose are that sometimes the symptoms arise later in childhood, and also often there's no specific diagnostic test to figure out what's going on because the gene that's linked to these conditions hasn't been identified yet.
So if it's frustrating enough for doctors and researchers, what about working with patients on trying to figure out these undiagnosed symptoms? And when do you know we've got to send you to a specialist?
Well, as a family doctor, I try to be a good detective. I try to rule in or out serious medical conditions and diagnose many common ones. But sometimes, despite a good history and physical and workup, you just can't figure it out. And that can be really frustrating for both the patient and the doctor, because often we want to treat the root of the issue, not just the symptoms. And so if, say, the workup comes up with something that's a bit of a flag, so an abnormal lab result or abnormal imaging, or the child isn't hitting their milestones or not gaining weight, then we'll refer to a specialist. But if nothing really abnormal pops up, often what I need to move into is reassuring the patient and the family that it's very unlikely that there's something serious going on, and then moving to manage the symptoms and improve their quality of life. That's actually a lot of what I do in my practice.
And it's a lot of work. What are the challenges when you are dealing with an adult compared to a child when it comes to these cases?
Well, children are not just mini adults. Their entire childhoods are continuums of change and development, and sometimes one symptom that pops up at one time might be gone in a month from now. So sometimes we won't aggressively investigate as much as we would with an adult initially. Also, we have to consider the entire ecosystem of the child. We have to think about what's going on at school, what kind of parenting practices there are, what they're eating, to come up with the right diagnosis and a good treatment plan. And often kids, especially if they're young, have trouble communicating. They really rely on the adults and caregivers in their life to interpret and communicate those symptoms. But I will say that even though kids can be challenging to diagnose sometimes, they are some of my favorite patients. They are fun to interact with. They give me really interesting answers to questions if they can answer. And it's a real privilege to be able to work with them and their families to keep them healthy.
We appreciate your time and your expertise as always, Dr. Melissa Lem. Thanks for joining us.
Thanks, Dan.